There is a continuing debate about the effect of parental involvement in a minor's right to determine their own course in reproductive health. The legal debate centers around such issues as a minor's maturity level in making a judgment, violation of parental responsibilities, and preservation of family as a social unit.
With regard to underage abortions, many states restrict access for minors. 35 states enforce parental involvement. 9 states have had parental involvement laws challenged, and in 6 states and the District of Columbia, there are no parental consent requirements. 34 states restrict Medicaid funding for abortions, which also restricts access.
The stakeholders include the parents, who believe they have the right to know what is going on with their children. The minors themselves, who believe in their own privacy, the doctors and nurses performing the procedure caught in these debates, and the Medicaid and payer system.
Mandatory parental involvement has been shown to decrease in-state abortions. However, studies conducted also show a negative correlation of parental involvement. Where parental consent or notification is mandated, there are increased costs to minors receiving the procedure. There is also an increase in anxiety and family conflict. There is an increase in minors traveling out of state for the procedure. Also, there's an increase in minors delaying abortion until the second trimester, which increases health risks. They are waiting either because of fear or because the 17-year-olds are waiting until they become 18.
Debate over the maturity of a minor making this decision has been addressed in psychological studies. In groups ranging from 12 to 15, no major difference was found across the age groups level of reasoning regarding decision-making for abortion. Ultimately, the findings show that minors can comprehend the risk.
In the state of Connecticut, minors under the age of 18 can obtain an abortion without parental consent or notification, as well as receive STD treatment, HIV testing, up to 6 outpatient mental health treatments, and treatment for drug and alcohol abuse.
Additionally, females under the age of 16 must receive specific information and counseling before obtaining an abortion. This counseling must include the possibility of involving a parent. Abortion statistics in Connecticut show that in 2006 there were 14,112 abortions performed in the state. 19% of those were performed on girls under the age of 19.
As a nurse, these issues present some difficult questions for you. To what extent do you believe you personally could participate in the abortion procedure? Would the stage of pregnancy and type of procedure make a difference?
Other difficult questions for nurses are that we have the right to refuse, based on our own ethical beliefs, to participate in an abortion procedure or the care of patients seeking an abortion. Additionally, employment in certain areas, such as labor and delivery rooms, may rest on the nurse's willingness and ability to assist with abortions and give conscientious care to a patient who has had an abortion. Nurses practicing in areas that provide abortions to minors must be concerned about parental consent and counseling issues.